bit of background on her. As Deputy Vice President of State Government Advocacy with PhRMA, Sharon has a very unique background and a blend of expertise, including state advocacy, federal policy, international advocacy, and focus on third-party outreach with both patient and provider groups. You know, what's very cool about Sharon, she's a clinician. She was trained as a registered nurse, has a real heart for patients that I've learned through dinner conversations, and really meant a lot to me to see her deep passion for this work that she does. Her experience with leading protocols of clinical trials at the National Institutes of Health and that clinical knowledge I'm referencing adds to her credibility in her current role, where she focuses on major policy issues and is constantly fighting for access and affordability of new and innovative medicines for patients. Prior to working with PhRMA, Ms. Lamberton was on Capitol Hill. She lobbied for long-term care issues and Medicare for a seniors association, has worked on rural health issues, as well as the Center for Research, Health, Policy, and Ethics at George Mason University. So Sharon, fantastic to have you. And before we get started foundationally, just great to get an update on COVID-19 as the country battles on. And thank you for sharing a lot of real-time information with us today.
Thank you so much, Sam. It is a pleasure to be here. And I want to thank you and your incredible team, Aaron, Morgan, and the entire staff. South Carolina Bio is such an impressive group, and it's really a pleasure for me to be here. And on behalf of my other colleagues, Thomas Hardaway, our great counsel, Heather Smith, Elise Wingate, Zach Poss, and others, I just want to thank you for this opportunity. For those of you all that don't know PhRMA, I just want to kind of give a brief overview of our work in fighting this pandemic. PhRMA is we have 34 member companies throughout the country, and about half of those member companies are actively working to find a treatment or a cure to fight this COVID pandemic. I'm so proud because typically our companies have been pretty competitive, fighting or really racing against each other to find a brand medicine and bring it to market. But today, in my 18 years and more unlike any other time I've ever seen it, we are arm in arm working together. And had it not been for South Carolina's strong research and development background and the work that South Carolina Bio and our member companies have done, I don't think would be in the position we are today. And I want to talk a little bit about that because it really is hopeful and very exciting to see how much effort we've made and how much progress. And we have some really good breaking news today too on a lot of those fronts. But before I do that, I just want to mention to you, we're going to show you some slides, and anybody that needs more information, we have some additional handouts, but this is really an exciting time. When you look at vaccines as a whole, we have about 258 different vaccines in the pipeline, and that's really ranging from cancer to HIV to allergies and other things. But when we're looking at COVID, which we are today, we're looking at a narrower set, but it is really good news to see what we're doing. When we started back in December, when we saw COVID break out in multiple different countries, we realized that this was truly a pandemic that we had never seen. And I am so proud that we were able to, within 4 months, actually code the virus and basically be much further ahead than we were with any other things like SARS, where it took us over 20 months to sequence the virus and bring a first candidate of a clinical trial compound to market. So we are much further ahead than we were, and there's a couple reasons why. This slide talks to you a little bit about what we're doing. We're looking at what's already on the shelf for our member companies that we might have that could be useful in fighting this pandemic. So what are anti-infectives or what are antiviral therapies that we could use? What are existing things that we can pull that would help us develop? We're also pulling resources from our scientists. We have a lot of clinical trials already underway for a number of disease states, but we are pulling together technology and people resources like we've never done before and shifting them to this area because we have to get back our country and our world back to normal. And to do this, it's going to require science and every bit of effort from all of us. The third thing we're doing is sharing clinical trial learnings in real time. You might say that's not different. That's what you all have done for years, but it is. We are sharing with foreign governments like Chinese Medicine Association, European medicines. We are looking at sharing with private and public groups, academia, all the agencies across the board, FDA, WHO, BARDA, HHS, all of us looking at how we can fight. And everybody has respective expertise, but it's that real-time sharing of information that is critical. And I'll give you some examples of that in a moment. And then finally, looking at affordability. Many of our companies have come out and said when, not if, but when that treatment or vaccine is provided, what are we going to do to make sure that this is affordable for patients all over the world? And several of them have made affordability pledges. So that's very promising and exciting to see. Even Dr. Fauci has said, you know what, I've never seen the industry price gouge in a time of pandemic. I don't expect it now. So we are very hopeful as we move forward in that conversation. The next slide tells you a little bit more about, again, what we're doing. And a lot of folks don't know that we are involved in pulling a lot of technology on diagnostics. We've used diagnostics to really code that virus in a much quicker manner. That's how we're going to get that vaccine approved in a faster rate. You might have heard the timeline of a medicine to get approved is about 8 to 10 years. Well, we're going to be able to get a vaccine to market in probably 14 months. And you might wonder, how are you doing that without kind of cutting corners? Or what are you doing that's bending the process a bit? And I want to clarify that great misconception that there is anything nefarious or anything that's being permitted that shouldn't or hasn't been before. And a lot of that is because of our technology. And I'll get into that in a moment. And then looking at the vaccines and really what are we going to do? The vaccines is the best way to provide that herd immunity that we're trying to achieve, and getting as many people vaccinated, healthy individuals as possible. But again, we need more shots on goal than ever before, because in vaccines, you have a 95% failure rate. That means only 5% of vaccines will make it from bench to bedside. That's a very risky and expensive endeavor. And so our companies need as many shots on goal. That's why you might say, well, we have heard there are about 4 front runner vaccines, and that is true. We have actually 4 vaccines that are in phase 3 that we're going to talk about in a moment. So I'm excited that there's a prospect of not just 1, but maybe 4 vaccines that will work. The more, the better. We don't expect one magic formula to be it. If there are several vaccines that will work to fight against this pandemic, that is great. So the next slide tells you a little bit about, this is my favorite slide actually, and it's changed, and I apologize because the number is actually better. We have 1,612 clinical trials as of today. I just got that update late last night, and that number is increasing on a weekly basis. So what does that mean? We have 1,612 clinical trials currently underway for vaccines or treatment for COVID. And that is wonderful news. When you drill down and you wonder how many is happening in the backyard of South Carolina, that was fascinating. I saw that 26 clinical trials are happening in South Carolina, 2 in Anderson, 7 in Charleston, 1 in Columbia, 2 in Gaffney, 3 in Grenville, 1 in Little River, Mount Pleasant, Spartansburg has 3, Union has 1. It's just really good news to see that there are clinical trials going on right there in South Carolina. And this is not new for our industry. We've had a lot of clinical trials underway for years. In fact, we have 1,097 vaccines that are currently open for other disease conditions in South Carolina. So it's important that we know how to direct our friends, our loved ones, and our patients to those clinical trials, because not only does it offer promise and hope for treatment, it also brings revenue. I'm really proud to say that over $319 million a year is generated from clinical trials run in the state of South Carolina. And of course, I'd be remiss in talking about jobs if I didn't, because this pandemic has taken a toll on jobs in general, but the industry, I'm very proud to say, has over 29,000 jobs right there in South Carolina. And average compensation is about $81,000 for a job as compared to $47,000 for an average job. So we're trying to bring not just treatments and cures, but we're stimulating a lot of the economy that needs to be stimulated because of the terrible stuff that the pandemic and the ramifications the pandemic has had. The next slide tells you about where those vaccine trials are happening throughout the country. I could spend more time on that, but I wanted you to understand that it's happening throughout the country. Now, our first clinical trials started occurring outside of the United States because we saw the pandemic, as you recall, first start in China, and we saw it in Italy and in the UK. So naturally, clinical trials and clinical trial candidates were easier to get outside of the country, but we do have many of them occurring right here in our backyard. And that's exciting to see. The next slide tells you a little bit about all of the companies that are involved. I had started out the presentation saying that over half of our member companies have something in the pipeline. And these are hundreds of clinical trials that are in testing, and there are many that are underway, but as I had mentioned, 4 are in the front runner of phase 3. And you all may remember, but the phase 3, there are 3 phases to a clinical trial, and phase 3 is the last and final stage. And so the next slide tells you a little bit more about where we are in this. But I have to pause and say how important it is that we have made sure that diversity is reflected in our clinical trials. We have seen so many unfortunate cases happening in the community of color. COVID is disproportionately impacting those communities of color. And there are many reasons for that. We know that there are a number of reasons, not just access issues, socioeconomic issues, but we're seeing even obesity as a comorbidity that predisposes patients to a harder trajectory, a harder recovery for those that might have COVID who also have obesity, for example. So it's really important that our clinical trial recipients and participants reflect the treatment population. So what does that mean? It means that we need to find that the diverse population, not just in race. We need the diversity in age. We need it in medical background. We need it in gender. We need all of those factors to be brought forth, because if there's an average, for example, of 30,000 participants per clinical trial phase 3, and we have about 4 in the front runners, that's not a lot. That's a lot, but we need to have as many profiles in there and clinical trial participants. You might have seen that just last week, NIH launched a $12 million campaign in 11 states. South Carolina was not one of them, but North Carolina and a number of others are. And it was strictly to increase the recruitment of diversity in COVID clinical trials. That's how important it is. So I just wanted to make sure when I touch on this slide, it leads to an obvious question. Even my family members have said, how are you able to shorten this timeline you're talking about? You say you're going to have maybe a candidate in 14 months after the pandemic was declared. How in the world is that? And it is because we've built, as I said, on previous knowledge where we've been able to code that virus in a quicker manner in 4 months versus 20 months, for example, when you look at SARS. Number 2 is we've been able to start conducting those clinical trials in different countries at the same time. The next thing, which is really interesting, and I've never seen this before in my 18 years, is that we've upscaled and started manufacturing doses of clinical trial compounds before they are approved by FDA. That's not just how competent our companies are, but how promising it is, because if they do not get approval from the FDA, what happens to those doses, those millions of doses that they are manufacturing? It's thrown away. That's tremendous waste, you might think, but if that candidate is approved, we will be all that much further to achieving our goal and getting that medicine out to the populations that need it as soon as we get the green light from the FDA. So those are some of the factors as to why we were able to go so quickly and be able to upscale manufacturing. We're able to do a lot with technology so that we can get that clinical trial timeline shortened. The next slide tells you a little bit about what we've just talked about, how risky and expensive, and how there's only 5% to maybe 10% that's likely to succeed when we look at the vaccines. However, it's really exciting because we're using different approaches in this vaccine than ever before. And I'm going to show you on the next slide why that is. And you look and you think, well, what is happening? And if you might switch to the next slide, Erin, it's interesting because we are using a variety of technologies. You guys probably remember our flu vaccine or even our tetanus, where we have to get it every 10 years because our body does not remember to be immune to the tetanus spores if we cut ourselves on a rusty gate, for example. So we need to get it refreshed, and our immune system needs a reminder to fight the deadly tetanus spores. So you need to get it every 10 years. However, our companies are using really novel technology, not just an attenuated or weakened vaccine like we do with the flu every year. We are using RNA technology. That means we're using the genetic coding of the virus and the recipient's genetic code to react and improve the immune system's response to the COVID virus. There's not been a vaccine, an RNA approved one before. This is new technology, but what does that mean? It means that our bodies will have longer memory and be able to fight the COVID virus for longer than if you just needed it every 10 years. It's going to remember to fight COVID should this be a continual thing year after year that we need to be able to fight. So longer memory means less doses, less need for adherence. If a patient only has to go and get it once, the shot once, or as in most of these cases, it's going to be one followed by another and final shot within 28 days. That's wonderful because it means less to be administered, less to keep track of, better adherence. If you only have to have 2 shots in your entire lifetime, you can imagine the benefits of RNA technology. So I want to pause and show you on the far right, not to discount all the wonderful work that you see from phase 2 and phase 1 in preclinical, but we've got to focus on phase 3. Those are our hot prospects. We have AZ, Oxford, Moderna, NIH, and BioNTech and Pfizer, all using different technology. However, not just all the RNA, we're using other AZ and Oxford are using different technology, but what's exciting here is that we have 3, and now as of today is our great breaking news. Today, J&J has entered phase 3, so we now have 4. So my slide is outdated as of this morning at 8 a.m. So it's good to show that I'm going to be able to shift J&J over to that phase 3 column. Now you all might say, wow, I heard about AZ and there's some problems. There was a pause in the clinical trial. I want to use this as a positive example. First of all, to say that they've resumed their clinical trial in many countries, and I believe they're resuming it in the US this week. But they had to investigate 2 instances where they had spinal cord myelitis. As a neurology nurse, I know that's serious. You have inflammation of the spinal cord. It usually means something else is going on. And in this case, one of the women who got this AZ Oxford dose had MS, multiple sclerosis, that was undiagnosed. And that was the reason for her spinal cord myelitis. We don't know why the second case happened, but it was serious enough, just these 2 in thousands and thousands of recipients that had these strange kind of aberrations happen. They stopped the clinical trial. That's how serious our companies are on safety. And I just wanted to use that as an example that if there was a 3rd case, that may be it for AZ and Oxford, who knows? But that's how serious we take any kind of problems in this clinical trial process. We want to make sure we know what happens, what was attributed to that spinal cord inflammation for those 2 individuals. Will that happen again? Has that happened again? And really look at it with a fine-tooth comb, figure out what is going on there and can we restart it safely? And so I'm really proud of all the work that they've done in the dedication because they've been able to restart it in other countries. And again, we have thankfully now J&J on board with a 4th candidate. The next slide I'm going to talk about goes into those approaches we did touch on. So you'll see about at 10 o'clock on that dial, inactivated influenza polio. That's the yearly vaccines that most of us, hopefully all of us, try to get if we're eligible for that and not allergic to egg or something. We try to get that. And it's important this year more than ever to get the flu vaccine so that we don't have the healthcare system burdened with additional flu cases that could be conflated with COVID. We have measles, we have all of these other childhood diseases. In fact, we now have 16, if you can believe it, 16 diseases that are now preventable thanks to vaccinations. And that's amazing because it saved about $1.9 trillion in societal costs. We've averted 8 million hospitalizations per year because of vaccinations. 936,000 deaths have been prevented. So really good stuff. And even looking at hepatitis, the hepatitis vaccine, we've been able to avert a $750,000 liver transplant. So there's a big return on investment, if you will, with vaccines and good things. But we are seeing different approaches, as I had mentioned, RNA and DNA being used. That are now novel approaches. So this is so exciting to see some of these new technologies being used by our companies. We don't know which one will be approved. Hopefully several different ones will be approved of these options, but the science is absolutely fantastic. But with the science comes some trials, and you might have heard this, that states are right now grappling with how they're going to get this vaccine out, because some of these vaccines require safe storage and handling, meaning they have to have precise temperatures. You have to, if you open a pack or a dose, the others must be administered within a certain amount of days after it's been opened. So the calculations that have to go into the actual steps that occur after we manufacture it, and it's then taken to distribution sites and then given to administrators like nurse practitioners and physicians and pharmacists in many cases who will be able to give these vaccines. There's going to be a lot of work that the state has to do. And I know South Carolina is underway and working with the CDC and the other agencies in developing a plan, but it is not easy. And we haven't seen something like this since almost polio. So where we are going to need to get so many doses out so very quickly. But it is exciting to see the different vaccines and approaches. I wanted to show this slide to you so you can see that it's not a one size fits all. We have a lot of different technology at play. The next slide tells you a little bit about what we had talked about. You know, you see that so many of our Americans have been impacted by a loss of a job, which means loss of healthcare coverage, or loss of the ability to have medicines that you need to stay out of the hospital and the ER and to be healthy. And so this has put a huge strain on patients and healthcare providers who want to find ways to get medicines to patients in a cheaper way. And this is a platform, medicationassistanceTool.org, that our industry, PhRMA, established that pulls together 950 different public and private programs that have access to free or nearly free medicines. Now, I hope that if you have a loved one or a member in church or synagogue or a neighbor, or even if you are a practitioner, a healthcare practitioner, you'll remember this, because it's not just for those that don't have insurance. It's for those that might be underinsured, that have insurance, but just not enough to cover a particular drug. Or they might have, they might be on a public program like Medicare or Medicaid. Please make sure to check this website, because many, many, many people are eligible, and several of our 34 member companies have expanded their patient assistance program since the pandemic hit in March to include even more range of folks that can be helped. The next slide does tell you a little bit about how that works, because you can learn about your medicine costs. You can figure out what the list price of your medicine is. You can kind of figure out what your out-of-pocket costs are and potential costs of the medicine. So really good information on medicines for patients. And then the final slide says is a great resource. Many of you all probably have heard heard about it rather, Healthcare Ready, which is a third party that the industry helped start after Hurricane Katrina. And it was because of those natural disasters, which suddenly caused patients to have an inability to fill their prescriptions. So if I'm a diabetic and I can't prove to you that I am a diabetic, but I tell you I need that insulin, and I don't have my hard copy prescription because it floated away or it's been destroyed in my house or telemedicine records didn't exist, Healthcare Ready will be that link that helps provide that conduit for a patient and a healthcare provider and a pharmacist. It'll actually help get supplies to your healthcare provider or to you as the patient. It will help not just fill your prescriptions on an emergency basis. It'll tell you what pharmacies are open in your area. And they've been tremendous in this pandemic. Again, typically working around wildfires and hurricanes, but this pandemic is one that hit universally throughout the country, not just in one spot. So I am really proud that we've worked really hard with Healthcare Ready to help fulfill some of those requests. So again, another good important resource for you. And that brings us to our final slide. One more after that will show you there's a lot of resources PhRMA has on both South Carolina Bio's website as well as on our own website. But if we can help you in any way get information, I know that Sam and Aaron and the staff, Morgan, know how to get a hold of me and my team that I'm privileged to work with a great team there in South Carolina. Our companies want to help. And many of the times we just need to get that request routed in the right way. So with that said, I want to leave some time for questions and answers if we have some, Sam. And I think we have about 8 or 10 minutes left where I am open to answer any questions needed. And certainly I appreciate this time to be able to talk about what the industry is doing in the space of fighting this pandemic in hopes that we will get back to normal soon. Thank you, Sam.
Okay, Sharon, thanks so much. That was a great presentation, and thanks for giving us such clear and comprehensive update that anybody could follow. I think explaining even elements like the clinical trials process and some of the safety pauses that had to take place was very helpful. And I'd be interested in your thoughts even on when we saw 9, I believe, CEOs of global pharma companies coming out together, making a pledge toward following every possible protocol needed, no matter how urgently we're trying to develop these solutions. I thought that was powerful. It's unusual to see probably that many marketing teams and corporate teams coordinate at the same time for such a big message. Any thoughts on that?
Yes, Sam, I tell you, I appreciate you mentioning that pledge, and it was science first, I believe was the catch line, but it's to say exactly what you did, which is to reassure the public that we have one of the safest approval processes in the world, safety records too of our products that have been in the pipeline and then approved. But it is distressing for me to see on the news this morning that there is a confidence rate as low as 70%. 70% or more of Americans will not get a vaccine due to their concerns about safety and how our industry might be cutting corners. That's a really, really scary thing. And I don't care what side of the aisle you're on in politics, it's a public health crisis, and it leaks into our economy and to our educational system. So I can't wait to continue working with South Carolina Bio and the great partners in South Carolina, the amazing healthcare providers and the public health individuals, because it's going to be key to reassure Americans and South Carolinians that our process is safe, that we haven't cut corners, and that this product, once we get it approved, should go out to as many people as possible. We have vaccine hesitancy. It's going to be all the longer than that it'll take for us to get back into our normal routines and see the trend line go down. So thank you for raising that, Sam.
Yeah, and we have some questions rolling in, so I'm going to toss some your way. What timing might you best guess or expect for development of an approved vaccine in 2021? I know that's a loaded question, but a fair question.
It is. I appreciate that. It even changed, Sam. This morning we've had word that FDA may look at extending the time by 2 months. We don't know yet, but there might be where they will not allow emergency authorization approval of this vaccine until it's been 2 months since the very last dose in the candidates in phase 3. So if that's the case and our clinical trial 3s wrap up in November, that's going to put us into the spring. And then of course the dissemination, as I touched on, is going to be a huge problem for states if we don't have something lined up on how it's going to get to the right places and who's going to be able to get those vaccinations to the patients that need it. So I'm looking at spring. I wish I had a crystal ball, but it changed from last night this morning to show that there might even be a 2-month delay. So we're anxiously waiting. ACIP is the body that will recommend the guidelines and the gold standards for us to follow. And we're anxiously awaiting those recommendations and to see how we'll come down on the timeline on that.
Absolutely, that's helpful. Another good question, will each state determine how to administer the vaccine, or will there be a coordinated national oversight?
Wonderful question. I was just on the call with National Governors Association yesterday evening, and there is efforts and coordination in trying to figure out what everybody's doing. South Carolina is very much ahead of the game in planning for vaccines and distribution. We've had some great things with Azar, Secretary Azar, who's allowed pharmacists to now inoculate children and adults when a COVID vaccine is approved. So that has been done with an executive order. So that's really good things to expand the scope of distribution and healthcare providers that can do it. So again, it is kind of up, there'll be a coordinated effort within the federal government, but as far as distribution and triaging the populations that should get it first, that will be mostly left up to the state. But you're in great standing with South Carolina with all the leaders that you have there.
Glad to hear that. How about influenza impacts? Another question coming through. How much could that complicate things if we have a bad influenza season this fall, schools reopening, a lot of other things in terms of exacerbating the current situation with COVID? And you know, we're still doing a very intense mask awareness campaign of social distancing, wearing masks. How important is all of that to just help us keep this under control, in your opinion?
Yes, you hit the nail on the head. All of that is extremely important, more important than any other fall or influenza season that we've entered. And we've seen some of the best experts who are testifying actually this very hour with Senate Help, the Health, Education, Labor, Pension Committee on the Hill right now. Fauci's up there talking about those two very important messages. Get your flu shot, wear your masks. Those are the best things we can do. Now, some patients can't get the flu shot or they are at risk. My teenage son has life-threatening allergy to egg, but there is an option that he can get. So find out if you can get that shot. If you can do it, go get it and wear your mask.
Okay, another simple but important question. Will the vaccine be expensive when it does come out and is available in the spring?
That's a great question. Because I'm a trade association, I can't speak on the pricing policies for my individual pharma member companies. That's a proprietary decision and a business decision. However, we don't anticipate any sort of price gouging or pricing that's unaffordable, because as Dr. Fauci said back in February, he's always seen a pharma member needed when there's been a vaccine approved to fight a pandemic, and he's never seen a pharma company that has priced it irresponsibly or in a way that's inaccessible to patients that need it throughout the world. So we don't anticipate it, but again, can't speak for our individual companies. The CARES Act, which you do know that has passed, CARES, which is federal assistance, any federal money given that helps in the development of a vaccine or a product, there is a requirement through the CARES Act that there's responsible pricing. So for our companies that have used federal funding from the CARES Act, that would be important. And that's an important protection, patient protection, that I should raise. So that's good that that's in place.
So I've got a personal professional question for you myself that I'd like to ask. SCbio had to pivot like everybody, and we had to kind of refocus our mission during this pandemic. And I'm going to say gratefully, some of the silver linings are we developed some muscles that we didn't have before and really some new approaches. So we will not be the same after this pandemic as we were before. And I'm imagining the same must be true for pharma, that, you know, since the Spanish flu in 1918, there's not been a pandemic of this proportion, you know, in modern times. How has it impacted pharma, even internally, and what shifts or different approaches do you anticipate, if any, for pharma post-COVID?
I appreciate that question, and it has been beautiful to see how South Carolina Bio has responded nimbly in this time, and how you all have managed to continue keeping your very strong team together. And that's important for all the strong work that you do. With pharma, it's unusual because, again, we're the trade association. Most of us have been able to work afar, but the member companies that we represent, not all of them can work from home. We need them in the lab. We need them continuing with clinical trials. However, technology and telemedicine has allowed us to do a lot more remotely. So that's been one benefit, which has been wonderful to see, and that's changed. But number two is our advocacy. We're now advocating, as you are, Sam, with state legislators, with governors, with federally elected individuals remotely. And that's good and bad. That's nice because maybe they're more accessible by Zoom than they might have been trying to catch them in the hallways or making an appointment. However, it means that we have limited amount of time and we need to be able to be concise with our message. Our message as an industry is help us help you. Please keep our innovation platform strong. We want to help fight this pandemic and get back to business of fighting other chronic conditions and improving lives. But you're right, this has never been seen before, but there are some silver linings, and I'm glad that you're a perfect example of that with your organization. I wish you all continued success with all that you do.
No, you're being very gracious, and we appreciate it. We benchmark a lot with other states, but I think, you know, we were all in this together, truly. And okay, another interesting question from one of our attendees this morning. He says, I've never had a flu shot and never had the flu. Why should I take any COVID vaccine? And I'm going to ad lib on that. I always get the flu shot, and for the first time ever, I contracted influenza A this past winter, despite getting the flu shot. So which indicates clearly there can be different strains that aren't covered. But yeah, good question for someone who's not customarily taken the flu shot. Is there a more compelling reason to take the COVID vaccine?
Really, it's doing your part to help the community and to help your family. And you hit the nail on the head. There's a concoction every year that the CDC approves of about 3 different types of flu strains. Hopefully they hit the mark this year. Every year may be different. Some years have been better than others. But the point is, if we even get a portion of it right this year, and we're able to inoculate and prevent patients from getting the regular strain of flu that we're going to see in our communities, that's going to reduce the amount of ER visits, the urgent care visits, the primary care visits, the transmission that will occur. Even though we're taking precautions with masks and social distancing, you're doing your part. So I'd hope that individual would call their healthcare provider, nurse practitioner, physician, and get that shot, because it's going to be good for you, for your family, and your community if you can do so.
Okay, and not wanting to be political at all when I ask this question, but maybe on the same sort of topic. In past, am I correct in understanding that the World Health Organization has often had a big role in determining that right concoction and trying to determine, you know, the vaccine that's going to be most efficacious? Does our lack of participation or less participation in the WHO impact us, and how are we handling it in the United States this year?
I think that's a great question. And I know that for pharma, we didn't take a position on our withdrawal from the WHO. As a nurse and as somebody that I see the value that WHO has provided, I'm concerned, and I'm hopeful that we can re-engage. However, that should not in fact impact our ability to have the better or the right concoction for the flu vaccine. That's kind of in addition and aside to that, from what I understand. But you know, the engagement with WHO and even with other vaccine groups, a lot of folks have asked, what is pharma doing to ensure that we get those vaccines to patients in other countries? And you might notice that China and Russia and the US are not part of a larger vaccine coalition that involves about 170 or so countries that are involved in the purchasing of vaccines. So we, you know, while we're concerned in our own community and also focused on South Carolina, we we would be remiss if we didn't talk about the global spotlight that we need to monitor and be active in. And our companies stand ready to work with all of those vaccine purchasing groups when ready.
Great. Listen, Sharon, we still have questions rolling in, and I could talk with you easily for the next 2 hours, but I wish we had more time. I'm going to have to move to the next session. Thank you for such a fantastic presentation. And I am grateful that our new virtual world allows for this, and it's the next best thing to seeing you in person. Thank you for staying in touch, and we will we'll definitely be engaging with PhRMA weekly going forward.
Thank you, Sam. Have a great rest of the wonderful program you planned. Take care.
Great. Thanks, Sharon. Take care. All right. That was a great presentation. I learned a lot as well. And up next, we're going to focus on marketing, the storytellers, the brand builders that help write and share the stories of all of our companies, all of our firms. And, you know, as a setup, I would say a silver lining in the pandemic is that a lot of our life science companies have been roaring forward like never before. We have companies in the state that have actually had over 100% increase in sales during this time. One of those will be featured this morning, Thorne, with Jessica Cokins heading their marketing efforts. Other companies have been hit. You know, their product portfolio is, let's say, more in the elective surgery category, and those have really been down, and they're waiting for that to turn and normalize again. Others have pivoted even dramatically in some cases, and there's some risk with all of that. But needless to say, marketing in a pandemic, building your brand and top line, it's not for the faint-hearted. It needs creativity and it needs expertise. And gratefully, you're going to hear from 3 of those this morning. So we are lucky to have Henry Pellerin, the president and CEO of Vantage, based in Greenville. Jessica Cokins is Director of Product Marketing at Thorne Research down in Berkeley County near Charleston. And Heather Hoops Matthews is CEO of NP Strategy in Columbia. So we got a good statewide footprint as well. So I want to thank all of you for joining us today. And let's get started with you, Henry, and just kind of maybe set the table for us on digital transformation and strategic investment with marketing.
Sure. First of all, thanks for having me, Sam. It's a great presentation that I had previously, and a great agenda you have set up for the day today. So appreciate that and all the hard work that the staff did to get this put together. It's a well-orchestrated machine. So what we're talking about as far as digital transformation is in the area of marketing. Sales and marketing transformation is something that a lot of companies have been focused on, especially in the last 6 months. There was a stat from Forbes that said that, you know, we're going to have 18 months or 5 years of innovation in the next 18 months. And what they were referring to is that there's several companies that did not have or did not invest in either a digital customer experience or any type of sales or marketing automations. And so we're seeing a lot of companies pivoting towards that and really trying to create that digital customer experience. And it's also not just because of the catalyst of COVID, but also, you know, our buying behaviors have changed. There's, 59% of the buyers will prefer to do research and search for things online. So we're really seeing a lot of change, innovation, and development in how people are doing business and how people are staying connected.
And Henry, one of the things that I know you had said that I really, it resonated with me, was that often during a crisis, companies can go one end of the spectrum to the other, either double down on marketing more than ever, or consider it almost a luxury if sales are down and cut there. I think what you've been laying out is a much more intelligent, thoughtful, customized approach based on the situation.
Yeah, there's, a lot of people will say, hey, whenever, things get tough, double down on marketing. But during these times, and we saw this after the financial crisis, is that you really need to be strategic in those investments and think of those a little bit differently. And a couple examples I'll give is, a lot of people would attend a trade show just because they attended a trade show, or that's what they've always done. This is really a time to think about things strategically And there's going to be contraction. As you mentioned, Sam, there's some industries that are just booming right now, and there's some that are having some challenges. But there's going to be contraction, and there's only really three ways to win whenever there is contraction. One is to either gain share from existing customers or get new customers, so gain market share. The second one is, an acquisition, acquire some of your competitors. The third is really broadening a product portfolio. And all three of those are very challenging, but the easiest of the three is to really do a great job, provide value, get more business from your existing customers, and think about it really strategically. And it's interesting, I know that COVID's a different situation than the financial crisis, but McKinsey did a really interesting study on about 3,400 different companies coming out of the pandemic, and those that really invested strategically in marketing in their business saw a 14% CAGR on EBITDA since between 2007 and 2014, whereas the other companies were below 5. So it's really important to think about things, try new things, leverage digital initiatives. The good thing about some of these things is they're not really costly to do. And it's a matter of just really taking some time and think about how to better engage with clients, what message I want to get out, how can I provide more value, how can I be an asset? Because as things turn around, and a lot of our clients have went from the survival mode to really focusing on growth, and it's really important to make that mental shift and that shift in your business on how do you okay, we responded in March, April, depending on where your business is located now. How do we grow, and what are we going to do, and how are we going to be different, and how are we going to leverage the investments that we're making?
Great, practical and strategic advice. So thanks for that. And I'll encourage all of our participants, attendees, feel free to be filtering questions in. We can weave them in, and we're going to get back to Henry in a second. But Heather, let's shift to you for a moment. And I think one of your topics is going to be kind of focusing on just the changes of clients' needs in a crisis like this, proportions that none of us could have expected, and the ability to be nimble. And as a licensed attorney who does not practice law, but works with a lot of them, I know you spend a lot of time working with a major law firm, and talk about getting lawyers out of their comfort zones and doing things like podcasts. So I think that's going to be one of those examples you can share with us today.
Yeah, they might have mocked me before the pandemic about doing a podcast, but they're not going to now. As Henry noted, and his company does, we represent a vast variety of clients. And so when this hit, we saw some of our clients struggle and some of our clients explode. What I did and my leadership team did was we paused for just a moment, and we realized that our team was scared. And so we told them, okay, look, we just adopted the slogan, be strong and courageous, and we're going to turn into the storm. So if you're standing on the beach, and it's blowing like crazy, and you turn into the wind and it's stinging your face, I said, that is what we've got to do. So let's do it. And so I'll give you one example of a client, Mako Medical. They're in North Carolina. They are doing COVID testing now, but we were serving them from a content need perspective beforehand. They did traditional laboratory services. And when COVID hit, obviously people stopped going to the doctor, so their revenue just plummeted. And I started working for free and helped them write the letter to lay off their employees. And so they too had that moment where they said, are we going to be strong and very courageous? And they laid people off, and the decision came, what do we do next? Do we close? Do we pause? Or do we rapidly change? And that's what they decided to do. So in 2 weeks, they got up to speed working with Thermo Fisher and started providing COVID testing. They are now doing so in over 20 states. They have topped 1.3 million COVID tests since April. They are the testing partner for the ACC, for the Big South. They are continuing to add really faster than I can keep up with them. And so their decision to press on really worked. You noted the lawyer. So NEN Strategy is owned by Nexon Pruitt, a 200 business lawyer law firm in the Carolinas. And I realized I watched the practice group mix do the same thing with our clients. And so I said, guys, you know, by 2022, the stat is that 80% of online traffic will be video, driven by video. So you have got to get on camera. Now that's easy for the old TV journalist to say, not so easy for like your IP lawyer, right? But we encouraged them to do 2-minute videos. And so in 4 months, we created 57 2-minute videos for the law firm. And NP Strategy is a new one there. We just started Marketing Minute this week. And we put those out on social channels. Well, what happened? You know, clients started saying, hey, I saw you on video. And other law firms started calling and said, you know, how did you do this? And we explained it. Like, we were not proprietary about it at all. We wanted everybody to win. We also encouraged them to launch 2 podcasts. And I think a crisis sort of gives us some grace to try something new and know that our peers aren't going to make fun of us if we fail. And so we launched 2. You'll see that, Sam, you're on there taking the pulse. You were one of our first guests on the healthcare podcast that is co-hosted with healthcare attorneys and myself. Last week, or this week it actually launched, but we interviewed Coach Staley, the women's basketball coach from USC, and she talks about practicing in a COVID environment and staying safe. And you talked about SCbio, and Lou Kennedy talked about Nephron, and so we're just trying to start this dialogue. We also decided, so healthcare is exploding, right? But economic development, what happens in a pandemic? That you would think go down. It hasn't in our state, which is a blessing. But we launched an economic development podcast to continue the conversation and to give people an out, really, to be able to talk and do something. You know, you're not gonna get on base every time you're up to bat, but I just want us to continue to be up to bat. And that's what I would encourage your participants today, is that, you know, collaborate. I started stalking all of the agencies and the law firms and companies that I want to be like. And I was looking for what they were doing. And then, quite frankly, we replicated it.
Right.
And so, you know, as Henry noted, digital is where you have to be. And I would say video in everything that you do going forward.
Well, I think you did a great job, I got to tell you, and it was a lot of fun for me to be on that podcast. And I think you've also discovered some talent with even some of your attorneys. Matthew Roberts, who
Yes.
serves on the board as a healthcare attorney, he was a natural. He looked like he
Yes.
should be doing a radio show with you. But it's a unique way to present, you know, really your subject matter experts publicly. And congratulations on some great creative strategies there. I know people are going to want to hear more about that. All right, so let's take it over to Jessica Cokins with Thorne for a minute. And Jessica, you know, again, so many companies had such different experiences during this pandemic. Thorne, you know, I'll say it's a company I'm very proud of, that is a board member company of SCbio and one of the top science-based nutraceutical supplement providers in the world, unique diagnostics, et cetera. And as people were trying to prevent getting COVID and to build up their immune systems and such, I imagine sales skyrocketed at Thorne, and yet your customers had whole different priorities, perhaps, and this and that. So I know you're going to share with us a little bit on focusing on customers and what their needs are and how you have to pivot even your marketing programs accordingly.
Yeah, you know, during a pandemic is whenever everybody begins to focus on health and wellness. And so naturally, Thorne is positioned in a really great place for that. But that did mean that, similar to the theme that Heather, Henry, and Sharon even talked about, we really had to be nimble in our marketing strategy. And so we sort of took 2 different approaches to that. One was that in January, so at the very beginning of the year, we were planning a massive digital out-of-home marketing campaign. Well, March hit, And most people were not out of their home. And so we had to quickly change that plan. So instead of looking at this digital out-of-home marketing experience, we had to really quickly work with our advertising agencies, our creative team in-house, and others to begin to pivot and change what that marketing plan looked like. So we began to think about, just like Franklin Covey says, begin with the end in mind. So we begin to think about where our customers would be whenever we wanted them to buy. And that's where we needed to be. So we looked at, just like Heather, we looked at podcasts. We began to look at videos. What type of marketing could we do? So we launched a brand new national campaign for online video. This was complete with, box stuffers in our packaging, video campaign on Hulu, those sorts of things. So we started to look at where our customers were going to be. Additionally, we had to look at their behavior. A lot of people are nervous to maybe visit the doctor's office. And so we wanted to make sure that we were able to provide some content that could help them with their health and wellness. So we began what we called a COVID channel on our website. This included interviews with doctors, blogs about how to stock your pantry to be healthy during this time, how to do video or how to do exercises with your kids behind you, those sorts of things. So we really tried to think about what our customers were struggling with and where they were going to turn for that content to help them. One other thing that's now interesting that we are looking at how do we capture this is that during this time frame, we did experience a massive customer growth. So we had a lot of first-time customers. So how do you nurture those first-time customers to continue to want to purchase with you and to continue to provide them the content and the health and wellness tools that they need to continue to buy with you? So that's one of the things that we are looking at now, is really continuing to nurture those customers, because it's great to retain those customers and get that first time buyer, but now you really have to nurture them so that they feel comfortable and want to buy with us and work with us more.
Right. Well, again, I want to say congratulations on really in the middle of a pandemic. It's been a silver lining to see how Thorne has moved forward, and you moved with your customers and made the adjustments that you needed to do in real time. Jessica, you've got a pretty varied background in marketing, which is great. I know you were at the South Carolina Research Authority for a while before Thorne, and it's been interesting to me as a public-private economic development organization and industry association, and you look at whether it's SCRA or DHEC or the South Carolina Hospital Association, different types of institutions also having to get a little more impactfully in the public eye and to establish their brand more clearly. I'd say DHEC in particular, there was such a lack of awareness about public health, and them having to message every single day, shoulder to shoulder with the governor. Any thoughts on that? For many of you, Henry included, where again, you have such a diverse portfolio of institutions, companies, firms out there that we're simply having to message differently and maybe a little uncomfortably. Any thoughts from you on that, Jessica, from your former SCRA role?
Yeah, I think, one of the notes on this is really whenever you're going through a crisis, this happens to be a global crisis, I think that it's really a time to hunker down on what you know and look at those values that you can offer your clients, whether your clients are those government or nonprofit organizations, or your customers are, direct to consumers or professionals. I really think that now it's a time to hone in on those values. And so that's what I think every organization, whether they're nonprofit or for-profit, really could use this as an opportunity to do, is to evaluate what your values are and to offer those to your core customers, whomever they are.
Yeah, just to add on, go ahead, Heather.
Thank you. And to really think about generating content as you do that. So, as Jessica noted, determine what you want to share and then share it across platforms, write about it, speak about it, do an infographic about it. I mean, you have to share that content ever more so, especially in the coming months, because it's going to be cluttered with the election. And so if you're going to continue needing to break through, you are going to have to be repetitive and on different channels and in different tactics. And one time is not enough. 10 times really isn't enough. And I think that many are starting to learn that. Sam, as you noted, DHEC and others, I think they're starting to see the need to talk more about themselves repetitively. Henry,
Right.
sorry to jump on you.
No problem. The only thing I was going to add to that is this is a time when more communications with your customers or your audience is more important, because if you don't communicate your brand, what you do, what you're about, you're leaving that up to others to determine what that is. And that's a scary thing to think about. And you know, everybody is having challenges. They're looking for new ideas. They are looking at ways to do things better. And those folks that help out their customers or their audiences, provide value to them, is going to, you know, benefit their brand. It's going to benefit their business, and they're going to be well positioned for, you know, strong recovery. You know, we did a lot of stuff early on in the first quarter where we did some pro bono voice of customer stuff for a lot of our clients, and it was really interesting to hear how people just needed help. They didn't know what to do in the beginning. You know, should my salespeople actually call on customers? Are people buying? And to just have that exchange of ideas and communication is extremely important. It wasn't business as usual. It's not business as usual. And it's just, you know, kind of reinforcing what Heather mentioned of over communicating. But I think the key thing is don't go dark. And now is a time to have where you can have a lot of added value to your audiences and your customers, and you can also you know, provide some differentiation. And really, it's a great time to build some brand equity.
Yeah,
Henry,
Go ahead.
sorry.
Jump in, Jessica.
We
Go ahead, Heather.
actually, sorry, Jessica, you go ahead.
It's okay. It's okay. I was going to agree with what Heather and Henry said, that it's really important during this time to communicate about yourself and what you can provide to those customers, because they are in need, and they need, you know, the support from you, being, you know, whatever your value is to that customer, they need you. And so they need you to communicate what you can do for them and to communicate loudly. So that I was just going to echo what you both said.
Two quick things that we're talking about specifically for the law firm, but that might help a wide variety of people on today. Number one, how are we going to get back together with people? So we've actually had one lawyer who's continued to do client visits, to fly and visit clients. And we got together, 52 lawyers, on a Zoom call last week and talked about some best practices with marketing. And he talked about how he did it, what the clients thought, you know, those that wanted him to come, those that weren't sure. The second thing on getting back together is, okay, how can we have an outdoor gathering? So down in the Low Country, there's a venue that's starting to have concerts outdoors, and you can do a pod of 4, steeplechase race, you know, things like that. So we're not doing the traditional get-togethers anymore, but let's start talking about it and making it happen.
Let me ask all three of you, when is it too much? Is it possible to overdo it? I think I'll just give you from an SCbio standpoint, where we're having to rely completely on virtual communication for the most part now. So we doubled our newsletters. We started doing weekly Monday moments, and et cetera, et cetera. Do you feel that over time you need to balance how much you're putting out there? You know, any words on that? And you know, back to Jessica, your good thought about focusing on the customer, your targeted audiences, the stakeholders. You know, is there some fatigue out there that we need to be sensitive to?
I do think there is some fatigue out there that we have to be sensitive to. You know, I think I really love how a lot of advertisers have taken humor to this approach. You know, you've seen a lot of commercials where now they're showing all of the awkward video teleconferencing moments that have happened. And, you know, you're now seeing grocery store commercials with customers wearing masks and things like that. So I really think that whenever you add that human personal touch, there is never, I mean, again, it's speaking to what your customers need and what they want. You know, I always think about for Thorne specifically, we are focused on health and wellness. We're not epidemiologists, so what we're providing people is information about health and wellness. We can't speak to the things that Sharon was speaking to this morning, but we can speak to how to prepare yourself with health and wellness techniques that could improve or support your immune system. So I really think that it's providing the right content to your customers whenever they need it, but there is a little bit of overload. I mean, we're all getting a little fatigued talking about COVID, but we know that it's a necessary thing to do. So it's taking that humor approach to it.
Great,
Yeah,
great
just to piggyback on that. So humor is a great approach. In fact, I heard probably stick, but somebody said that the quote of 2020 is, "Am I on mute?"
Exactly.
But so really,
that is perfect.
Or you are on mute.
Yeah, exactly. I lost my train of thought on that. But when it comes to too much communication, or is it enough? I think that there is some fatigue, but I think the good rule of thumb is, am I continuing to add value? Because there's so much different information and different data points, and things are evolving, and some places are opening, some places are closing. There's so much information and so many things that are changing that it's necessary to communicate. So there's a balance of reinforcing, but also a balance of continuing to add value and not just having the same thing.
Good comments. Heather, I'd like to hear from you on that too. Again, you introducing so many new tools and strategies, and how do you balance that?
Well, I would continue to charge the hill. Because I think it's so cluttered and it's going to be so cluttered right now, that I think we're going to have to continue to use all platforms. I saw someone on chat ask about media relations, and many on our team are former working journalists. And so what we have continued to do is just write press releases, and write them in a way where they're almost scripted, where they can be placed as is. We've sent photographers out to shoot video for journalists because they are dispersed like we are. And so we're trying to get content out there and make it easy on them to continue to be used, so it continued to be used, and to elevate our clients as thought leaders. And it's easier in some markets than others, quite frankly, but I just feel like we've got to continue to be up to bat. And, if we got feedback to the point where you're annoying, I want to mute you, then, we definitely pull back. But at this point, we've seen success in just continuing to think for all of our folks, like, have you been out there this week? What have you posted? What have you done? Is your LinkedIn bio up to date? Do you have a 1970s photo, or do you have no photo? Are you connected? Are you giving 5 or 10 minutes a day to LinkedIn to do it, to try to connect and nurture your environment? Because really, we told like the bankruptcy group, when we were closed down, they were closed down. But we said to the bankruptcy lawyers, like, look, when this opens back up, you're going to be busy. So get ready now. And the end of 2020 some of you might be in that position where you're still sort of in a holding pattern. I would say get ready now.
Great.
And you can do simple things like write a blog, about anything.
Yeah. And, one of the notes too on this is thinking about when are you communicating too much to a consumer, or are you communicating the right thing? One thing that we have used, I've just thought about this, was tools to help us see what a consumer is trying to learn about. What are they curious about? So we use tools like Google Keywords to really track and see what has spiked lately. With consumers, what are they now Googling about that maybe they didn't before? And then that's something that we should write about. That's what people are curious about. So that's one thing that has really helped us guide the content that we're writing. So whenever, Heather mentions blogs and we're talking about videos, based on that feedback as to what, and that simple tool, Google Keywords or even Google Trends, is telling us, that's what we begin to tailor our content to fit, is what people are looking for. So I think that's what's important too, is knowing what they're looking for and using whatever tools you have to try to find that out.
Yeah, Jessica, that's a great point. There are a variety of tools that are all affordable where you can not only understand what they're interested in, but as you send out content, which things are they engaging with the most, and continuing to, it's almost like a continuous improvement process for your content development, right?
It
You know, you
is,
get the
absolutely.
information out there and then you see what people are engaging with, and then you provide some more information, and you continue, that's how you continue to meet the needs of the market and how those tools work together.
Exactly, Henry. Exactly.
Good questions are rolling in. Here's an excellent one, I think. What are your thoughts on how the online platform will affect the long-term commercial real estate market and higher education? So again, such a diverse group of entities out there that are having to adjust.
We've watched the commercial real estate practice, pick back up. And so the online platform, that's a good question. And I don't really have a solid answer for that, except I'm sure that they will use more digital outlets to either communicate, to site visit, possibly to promote. But thankfully we have seen that start to restart.
I know personally, I can't speak to the commercial real estate platforms, but in having some experience with higher education platforms, I do know that they're looking to, again, be nimble and modify to fit their customer needs. So more classes than ever are being offered online, even up to labs are working through an online setting, which is interesting because that's not the experience that, I had whenever I was in school, but everybody's being nimble. I have seen, not for commercial real estate, but for other real estate markets, that you've seen real estate agents start doing drone footage, doing videos inside the home, much more than just photos. So you've seen their tactics completely shift to now providing those online tours through the homes versus taking people through. So I've seen a lot of that change.
Yeah, so things I'll comment on is related to higher ed. So I'm actually on the Anderson University board, and also do a coach for UNC's entrepreneurship program. And what I've noticed is those that are they're shifting, they're having to be nimble, they're having to pivot, and the ones that are focusing on really career needed certificates, or really focusing on career development, not just on education and value in that. I believe education, higher ed, is going to really be different coming out of COVID. I think we all have heard stories one way or the other, but it is probably the one that's going to be the most disruptive. We've already seen some disruption in real estate with either some of the apps where you can share different building locations or conference rooms. So I think you're going to continue to see more of that. But the one that I think is really going to change, that hasn't really been disrupted, is the higher ed. And you're going to see more online platforms. And it's interesting, in this board meeting, we had some more tenured folks like myself, and we also had some younger folks. And it was interesting, the debate on those of us that had an in-classroom experience versus the folks that had an online experience, how there were some compelling reasons on why they felt they got a better education online than in person. They could meet with people all over the world. They didn't have to wait and make sure everybody came to one place. They built relationships and network that are global versus just in the classroom. So there's, the online platforms aren't going away. And I think you're going to see more enrollments on that side than in person.
I think we are all having to acknowledge some efficiencies are being gained. We did a meeting the other day with every single international office that the state of South Carolina has, from Korea to Japan to China to India to Europe at the same time. We would have never pulled that off in a person-to-person kind of meeting, and it was extremely focused. So I think all of us are gonna, how do we leverage the fact that things like telemedicine pole vaulted forward 10 years in 2 or 3 months, and there's some seismic changes and echoes from this that can be helpful, even though we got to battle the fatigue of being virtual so much at this present time, right? Let me throw another good question out here. Getting great compliments on y'all's advice, and it's great for me to hear from the pros in the marketing space as well. I'm learning a lot. This question says, if you could gear some advice more toward the smaller companies, the let's call it some of the moms and pops, and if that's, whether that's a startup in life science or early stage companies and that have limited budgets and are just kind of building their brand, thoughts on that?
I think that's easy to do. And it really is. You don't have to look like a movie star on video anymore. So if you've got an iPhone camera, you can start posting your own videos on your social platforms. You've got to be on social channels. If you're, a small business, I would do them all. It doesn't matter if you, think not a lot of people are looking on one platform. You might get a prospect from that platform. So it's easy to use software that lets you post on all of them. But you have to manage that. But I think now is the time to try things new. So do letters to the editor, editorials online and in your local paper. Call the local journalists and pitch a story. Offer to be a thought leader or an expert on something. Tell them how their readers might learn something that you would have to share. And then pick up the iPhone. I hate it when I see myself. See how much I've aged and all that, but get over that. We all feel like that. And just get out there. That's what I'd say. Social channels for sure.
I in my past life, and even I worked with a ton of startups and small businesses, and even still have a lot of friends that are managing their small businesses through this crisis. And one of the things, just like Heather said, is that what's really important is now more than ever, people are on their phones. They're scrolling through Instagram, scrolling through Facebook, scrolling through Pinterest, reading the news. This is the perfect time to use those digital advertising platforms that are pretty cost effective to share your message. And, some of it is creating those personal videos that you can, make as casual as you want, because I think that's what people like to see. That it makes you real. It makes you, more like them. And so I think using those platforms, we have really seen a lot of people use IGTV or Instagram TV, IGTV now, and post those videos, and they're really great. You see a ton of great responses from them. So think about how your brand or your product can benefit from IGTV, even if it may not be the person who you are specifically targeting that will end up using that product. That's a great tool for awareness of your brand and awareness of of what you can provide. So I love IGTV and Facebook for specific things, but these are great, pretty inexpensive platforms to test it out on and begin to see what sticks and what doesn't stick. And write a blog and send it to people who are looking for blog stories, in your space. So what are people reading that are buying from you? Go to those online journals or online blogs and figure out maybe what you can write that you can submit to them, and then they could publish it on their platform. So this is a good opportunity for the little guys and gals, as you said.
Yeah, so the only thing, I'd add a couple things to that. The first one is having had the opportunity to do some coaching with a lot of startups and entrepreneurs. The biggest thing I see is not having a clearly articulated value proposition. Spend some time and really think about honing that in. And then once you do, just pick one or two things to do, whether that is you're going to own video and just put something out there and be consistent. I think it's easier for a small business to do some of these things because they don't have all these different divisions fighting for resources and what they're going to do. But I think the biggest problem is that people that don't have a strong value proposition or know who their target market is, they don't know what to say, let alone where to get it out. So if that is done first, then it's going to be really easy to get some content out there. The other thing I would say is, we're in an area where there is a ton of great educational resources and universities, and there's a lot of folks that are looking for, you know, side gigs or a case study or a project for a class. Those are great avenues to reach out to get some of those things done. But I just stick with the first one is probably the most important, is identifying, have a clear value proposition, know who your target market is, and then just pick one or two things to get that message out there on, and be consistent with it.
That's very true, Henry. One thing that I kind of think about whenever you're talking about the value proposition and what we've helped a lot of companies work through is, whenever you're speaking to that value proposition, also speak to the benefits to the customer. Don't speak about the science, don't speak about the features, because that's important to you, but speak about the benefit to the customer. And that has to be in your value proposition. If it's not, then you're not speaking to the customer or speaking their language.
Yep.
Yeah. And as we're in our last minute, and as usual, the questions are coming in, and I wish we had more time. Henry, I think you gave a great takeaway with that last statement you made. Let me ask Heather and Jessica as well. Is there a final takeaway statement that you would like to leave with the attendees in terms of focusing going forward?
Jessica, you go ahead first.
The pressure is on. I think that the final takeaway is really beginning with the end in mind. That's what I always think about as I approach projects. What is the end that you want to see? Is it a purchase? Is it awareness? What is it? And then that's what you have to work towards. That has to be your goal, and what you do has to angle towards that. So I think that's probably the best takeaway.
Did great under pressure. Excellent. How about you?
Yes. And to just really turn into the challenge, to not hide from it or try to avoid it, but to collaborate with your peers, get together, huddle up, and just determine to press on. I think we all have to have great grace with each other right now, but I really think together that we can get through this and be better for it, frankly.
No, absolutely. And I want to say, Heather, you kind of inspired me with that standing face in the wind and the sand stinging on the beach a little bit. This does. It takes resilience. It takes a little fierceness. I think something we've all indicated, that while there's a balance, communicating in a number of ways that we can right now is so important. And thank you for all the expert advice that you provided today. I know I learned a lot listening to this, and we're very proud to work with all of you.
Thanks for having us.
Yeah, thanks for this, putting this on, Sam and the rest of the team, and thanks for having us.
Yeah,
Absolutely.
thank you.
All right, great. And I know that those insights were helpful to everybody at some level, and we're getting ready to move next into our breakout sessions. Links are in the chat. Click where you want to go next. And as a reminder, first, there are 2 sessions next. One is focused on workforce. Another one is focused on collaboration. And again, the links are in chat on the side of your screen. Lou Kennedy, CEO of Nephron and board chairman for SCbio, and Jimmy Descani of Arthrex are highlighting the workforce session for us today. And then you also have an opportunity to learn how to more effectively partner with research universities. We have leaders from USC, Clemson, and MUSC, all here to share more on how to collaborate in that other session. So we look forward to seeing you back here after the 2 breakout sessions for our networking session. So enjoy and keep going onward.